When we go to order IV fluids each week, we do not get the amount of cases that we request.
This year's flu season has put IV bags like these in really high demand. But last September's Hurricane Maria cut right into the inventory for the hospitals that really need them.
That's right. NBC Connecticut's Christian Cordero joins us live from Hartford Hospital with the story and how they're trying to solve this. Christian.
Well, Mike and Carrie Lee, saline bags like these are critical. They're used to hydrate patients and administer medication. It's usually a no-brainer to hook this up to a patient in need. But over the past few months, professionals here at Hartford Hospital have had to think twice.
As a devastating hurricane made its way towards Puerto Rico.
Yeah, Maria is a really frightening storm. This is about as strong of a hurricane as you'll see.
A relentless flu season was on its way to the mainland.
Hoping that people stay healthy and wash their hands.
For people who could not escape this year's flu virus and for the health professionals who treat them, saline bags are hard to come by. One of the 3 major IV bag suppliers has a plant in Puerto Rico, and when Maria hit, production slowed for months. It's at full capacity now, but Dr. Eric Arlia says that's not necessarily the point.
When something happens unexpected, whether it's to a plant that makes IV fluids or a plant that makes a certain medication, if it's only made in one place in the whole country, there's very little ability for the supply chain to manage that.
He, his fellow doctors, and Senator Richard Blumenthal want the Food and Drug Administration to acknowledge the lack of redundancy in this part of the industry. And it's not just saline.
We have at least, I'd say, 15 to 20 medications right now that we are unable to obtain in full quantities.
Dr. Arlia believes there's little incentive for companies to tap into this part of the health industry because at $1 or $2 per bag, the profit margin isn't much. But the cost, he says, goes beyond the numbers.
It just becomes another thing that our medical staff has to keep on top of and, pick a different medication than what might have been their first choice.
Now, Hartford Hospital told us its alternative methods are just as effective clinically as the ones that they're used to. And also, when there's a hospital in its network that is in need of something specific and they're short, well, the rest work together to get those items where needed. Reporting live in Hartford, I'm Christian Cordero, NBC Connecticut News.